Hi, my name is Ariel Rosenberg and I'm a registered dietitian for the Clinical Nutrition Department at Johns Hopkins Bayview, and I've worked with many cardiac patients throughout my time at Bayview. I wanted to walk through the grocery store with you and help you look at all the foods with a keen eye to help you figure out which foods are high in sodium and which foods are lower in sodium that would be perfect for your shopping cart. Many people think that they are in the clear if they don't pick up the salt shaker and use it in their cooking, when in fact most of the sodium that Americans consume daily come from processed foods that they may buy in the grocery store. Watching your sodium intake is really important since high amounts of sodium in your diet can lead to hypertension, increased risk for cardiovascular disease and stroke. So for tip number 1, I would recommend sticking to the outside of your grocery store. All grocery stores are pretty much set up alike. If you stick to the outside of the grocery store and stay away from the center aisles, you'll be choosing more low sodium foods there. A lot of these foods are natural and they're not processed, so this would be a good place to start. For tip number 2, if you happen to make it into the center aisles of your grocery store, the most important thing you can do is actually read the food label. The food label does not lie, and I always tell my patients knowledge is power. So if you know how to read a food label, you can be in the clear, you can make healthy decisions. So for example, when looking at this packaged rice, 1 serving is 1 cup of cooked rice. So in 1 cup of cooked rice, you have 666 milligrams of sodium in just that 1 cup. This is a really high sodium food. The American Heart Association recommends that the average American consume 1,500 milligrams or less of sodium in a day. Anything that is 140 milligrams or less in sodium per serving is a low sodium food, and anything higher than 300 milligrams per serving is a high sodium food. So this, as you can see, would be a high sodium food. For tip number 3, I would recommend watching out for those canned goods. Canned soups and canned vegetables are huge culprits when it comes to consuming high sodium foods. So as you can see, we're in the canned food section. For example, if you pick up a canned soup and it says 25% less sodium, this doesn't necessarily mean that this is a low sodium food. It just means that this can of soup has 25% less sodium than the average canned soup. So as you can see, if you turn over the food label, this soup has 650 milligrams of sodium, which is still considered a high sodium food. Instead of choosing canned soup, I recommend making homemade soups. This way you can control how much salt you're adding to your soups. So another good tip if you make it into the center aisles is to look above and below eye level, because a lot of times at eye level are the unhealthier, higher sodium foods. So for example, over here we have the nut section. The unsalted peanuts are down here, where the salted peanuts and almonds are right at eye level. For tip number 4, I really want you to try to avoid those TV dinners or microwavable meals. Those are really high sodium foods. Those are some of the worst culprits. So for example, this pre-made shrimp dinner over here, 1 package is your whole serving size, and in this 1 package, you get 960 milligrams of sodium. That's more than half the amount of sodium you need in an entire day. Remember, you want to stay less than or equal to 1,500 milligrams of sodium. Another great tip is look into the dried herb section of your grocery store. This is a great way to add some flavor and taste to your foods. One of my personal favorites is Mrs. Dash. Mrs. Dash offers a wide variety of different spices, and they're all salt-free, which is excellent. Another choice is the McCormick. So McCormick offers a couple different salt-free herb blends as well. Another thing I would recommend trying to stay away from is your pre-packaged lunch meats. If you do want lunch meats, I would recommend going to your deli counter and asking for a low sodium option. So now that your basket is full of some low sodium foods, I encourage you to go home and make some low sodium meals. It's always healthier to make your meals at home rather than going out to eat. But if you do decide to venture out, I encourage you to ask your waiter or waitress for low sodium options. My favorite request is, please hold the salt.
What is a soft food consistency? It's sometimes called texture A. When preparing your food, make sure you thicken the sauce or gravy to the recommended fluid consistency. The fork test. Soft food is easily cut with the edge of a fork and can be easily squashed with a fork.
Hello, my name is Lisa and I'm a dietary manager, and today I would like to work with you and show you a little bit about mechanical soft textures. And I'm going to start with some roast beef today. I've already prepared my roast beef, and these are some of the ends and pieces that I have that I'm going to use for mechanical soft texturing. I'm going to be using a RoboCoupe today because that's what I have in my facility. By far, you can use lots of different equipment pieces to mechanical soft your texture. So I'm going to start off by placing the meat in the RoboCoupe. As you can see, I've just got various size pieces of meat. Break them up as you wish, and we're going to insert them into the RoboCoupe. Going to make sure our blade is in place securely, and just add them in to the RoboCoupe. I'm adding no liquid into my RoboCoupe at this time. Make sure your lid is securely in place. You're plugged in. I'm going to turn it off. I'm going to check my texture. I don't want a fine ground to powder. I just want a nice grind on my meat. I want you to be able to see what I'm getting here with my texture. Maybe you can see it better here. So this is a nice grind. You still have some moisture. There's no powder. It's going to be a nice palatable ground meat. This didn't take very long to get. We want to make sure we're evenly, consistently ground to this texture. Removing my blade, making sure I've got everything, no strings, a nice even mechanical texture to my meat. Per our food code and most of your building's policies, you're going to add some gravy to this. You don't want to powder, but you do want your meat to be even ground. And you don't want to powder, as I keep saying, because you want that moisture in your meat and you want it ground evenly, so you're not going to have any choking hazards for your residents, and you're going to have a palatable texture for them to eat. So that's your mechanical meat. Still got a lot of flavor in your roast beef, and your gravy's coming. So that's our first step to our mechanical meat. Okay. So we've got our mechanical meat, and now we want to start into some puree with that same meat. Remember, when you're using your meat, you're going to have to bring that up to temperature, and it is now a leftover. So you're going to have to bring that up to your 165, because that's the temperature for leftover meats, or any leftovers. They have to be reheated to 165. So we're going to continue now as a leftover. So we're going to take our mechanical meat, and I like to start out by adding a little gravy. This is my beef stock gravy. So I'm going to put a little bit of that into my blender. So I start with a little moisture on the bottom. I've got my mechanical meat. I'm adding that in, and I'm using about a cup of ground meat here. And this is just my roast beef. And then I'm going to add in A little bit more of my gravy. You're going to need to be patient as you're making your pureed meat because you need to make sure that you're going to get a nice, good texture. This is going to be a little loud and we're going to get started here. As you're going, you're going to be moving your meat and your gravy together. You're not going to be adding any water. It's okay to add a little stock or adding a little gravy to keep that consistency nice and smooth. This is a great time if you're going to be using this, since it's roast beef, if you're going to use horseradish sauce to add in a little flavor. This would be a good time to use that. Because if you pureed meat, you know that you get a little bit of a stringy texture as it's pureeing, and that's why it's important to keep and be patient, because you need to keep adding flavor, adding moisture, and that's why you start off with about a cup of meat to make sure you're going to get enough portion for your 2-ounce portion that you're looking for. Okay, I think we have our creaminess that we're looking for. A pretty smooth puree texture. What I like to do, and you can't always do this because depending on when your resident's diet order comes in, but if you can prepare your puree a day ahead, everyone doesn't have a mold, but you can take some saran wrap, you can mold this into a bowl in your freezer. It is a leftover, so you're going to bring that temp back up to 165. You mold that and then slice it like a medallion. Then you have medallions of meat. The texture is there for your pureed meat, but it'll make a nice presentation on your plate with medallions of meat, just like you would with a nice pork or roast beef medallion in a nice restaurant, or like you're serving your roast beef medallions on your plate today for lunch. So the last thing we want to try to do is some vegetables. Fresh vegetables are perfect, and most of them you can get year-round. If you can't get fresh, go with frozen. So today we're going to do some carrots. I've got some fresh carrots, and what I did, I just took some fresh carrots this morning. I peeled them, sliced them up, put them in the steamer, and I've got some here that I've cut up that we've used kind of on the die, and then I've chopped them up into little bite-sized pieces, and this is your mechanical carrots. And all I've done is I just took them and we've just kind of made little bite-sized pieces. Nobody wants to take their carrots and put them in a food processor, a blender, a RoboCoupe. They come out this mixture of chopped and grated. That is not eye appealing, and if you're on a mechanical soft diet and you see that grated mixture, you don't really want those carrots. And that is a moist mechanical blend of a diet. So for a mechanical soft, you just need small bite-sized pieces of soft carrots. So if you put those little carrots in the steamer, soften them up, which we've done here, they're very tender, they break apart, then that's mechanical soft. So that's your first step. So we have a nice bowl of those. We're going to take these carrots and we're going to puree them. So we're going to put them on our blender. You could use your RoboCoupe, but my RoboCoupe's pretty big, so it's going to take a lot. If I have a lot of mechanical soft, then that's the way I would do it. But since I don't have a lot of mechanical soft, I don't need to do that. So with this, you're going to add them into your blender. This one you probably will need to add a small amount of moisture. You want to be careful with this again because you don't want to be adding too much water because that's going to take it away. So just keep working with them till they're good and smooth, because that's what you want, is a nice smooth consistency, no texture. And that's what you have. And the key to a good puree is to make sure that you have enough product in your blender. That's how they're going to get their nutrition. So I hope this helps today, and thank you for your time.
Hello, welcome to this video from Tideswell at UCSF. This video is designed for caregivers of older adults with dementia who have urinary incontinence. Urinary incontinence is defined as any leakage of urine or inability to get to a toilet in time. If your loved one has new urinary incontinence, discuss it with a doctor. There may be reversible causes, such as bladder or kidney infection. In men, history of prostate cancer with radiation or surgical treatment can be a cause. In women, decrease in strength of the pelvic floor muscles and an overactive bladder are common causes. The following are some strategies that might help to decrease incontinence episodes. Timed urination, or timed voiding, can help regulate your loved one's use of the bathroom. The goal is to prepare your loved one to use the bathroom on a regular schedule. However, this can take time and effort. Start by providing gentle reminders to your loved one to use the toilet at short time intervals. If your loved one is using the bathroom or having accidents every 2 hours, start out by deliberately reminding her the opportunity to go to the bathroom every 2 hours. Gently lead her to the bathroom and encourage her to use the toilet, even if she does not initially feel the need to go. After a few days, stretch the time interval between the trips to the bathroom by 15 to 30 minutes. Eventually, your loved one may be able to extend the time between bathroom trips to 3 or 4 hours. Remember that time voiding will not be successful overnight. Do not argue with an older adult who does not want to use the bathroom, but instead use gentle reminders or commands, such as "let's go to the bathroom," rather than asking. This technique may not work in older adults with very advanced dementia who can no longer respond to requests, and may increase agitation due to their inability to understand what the caregiver is asking. Getting up to use the toilet at nighttime can increase the risk for falls and disrupt sleep. For safety, remove all obstacles such as rugs that might make the ground uneven. Set up motion sensor night lights to help your loved one see in the dark. If possible, move the bed so that your loved one can see the bathroom from the bed. Consider painting or labeling the bathroom door. Disable locks so that your loved one cannot accidentally lock herself in the bathroom or bedroom. Some older adults who suffer from incontinence or frequent urination think that decreasing their fluid intake will decrease their need to urinate. However, drinking enough fluids is important to maintain metabolism and kidney function. Do not deny your loved one liquids if she complains of thirst. Avoid liquids that are bladder irritants, such as tea, coffee, or sodas. Also avoid drinking fluids near bedtime. Go over your loved one's medications with a doctor. Some medications can increase the need to urinate, such as diuretics, commonly known as water pills. If your loved one must be on a diuretic, consider changing the schedule to nighttime when your loved one sleeps. If nighttime urination is a problem, then take the diuretic during the day and use the toilet on a schedule. Urinary incontinence often leads to fear of having an accident or not being able to find a public restroom outside. These fears can lead to social isolation and depressed mood. Don't let this problem keep your loved one at home, but do take steps to prepare for incontinence outside of the home. Using disposable garments such as pads or diapers may allow your loved one to feel more secure about leaving home. Pack a bag with a change of underwear and clothes, disposable wipes, and extra pads or diapers to ensure that your loved one can clean up easily in the event of incontinence. There are also various cell phone applications that can locate the nearest public restrooms that may help reassure your loved one. We hope these tips have been helpful. Talking to other caregivers of older adults with dementia may give you other helpful tips on preventing and managing incontinence. Consider joining a support group for caregivers. Many older adults suffer from incontinence, so you and your loved one are not alone.
It can happen at any age.
It's probably one of the most common bacterial infections that we diagnose in medicine.
Doctors say urinary tract infections, or UTIs, are most common in women.
And it's more common in postmenopausal women, but it can also be more common in younger women that are becoming sexually active.
UTI is an infection of the urinary system.
Typically, either the urethra, which is basically the tube that urine comes out, or the bladder, or going all the way up to the kidneys.
It's usually caused by bacteria.
Sometimes, like, new sexual activity can be a cause. If you have poor hygiene, sometimes, like, our debilitated elderly patients may get it more frequently because they're not cleaning well.
Symptoms can vary from minor irritation with urination to fever, chills, even vomiting. If the symptoms are severe, patients can even experience back pain.
If it goes untreated, it can affect the kidneys.
One way to prevent a UTI is to make sure you're drinking plenty of water.
One of the ways that the bladder helps protect itself is to urinate and to clean itself out.
If a patient has symptoms, doctors can prescribe antibiotics. It's important to pay attention to your body and not to let the infection go too long without treatment. For Lee Health, I'm Lindsay Morton.
Like most automatic processes in the body, we usually don't give our respiratory system much thought until something goes wrong. Feeling out of breath after a tough workout is one thing, but you should seek medical attention if you experience lasting breathing troubles or sudden severe shortness of breath. The average human can live around 3 weeks without food and 3 days without water, but just 3 minutes without air can lead to brain damage and death. Here are some conditions that can impede the ability to breathe freely. Number 1, allergies. The role of a healthy immune system is to fend off potentially harmful foreign invaders like bacteria and viruses. Unfortunately, an overactive immune system may target less harmful substances like pet dander or pollen, leading to an immune response known as an allergic reaction. Symptoms may vary depending on the specific allergen and the mode of interaction, but common signs of an allergic reaction include throat, lung, and nasal inflammation, coughing, and shortness of breath. Number 2, obesity. More than 1 in 3 American adults are obese. Obesity increases the risk of a whole host of health issues, including diabetes, MS, heart disease, and cancer. In addition, excessive body fat literally weighs down the body, which can worsen wear and tear on joints and reduce one's ability to efficiently fill the lungs. When combined with inactivity, this reduction in lung capacity can lead to chronic shortness of breath, further complicate attempts to become more active, and worsen other respiratory issues like asthma. Number 3, respiratory infection. Respiratory infections are a broad category of illnesses that range from the common cold to influenza and pneumonia. These infections can present many symptoms that may interfere with normal breathing. Such symptoms may include a lasting cough, congestion, and inflammation. While these infections are generally short-lived, severe respiratory infections in infants have been linked to an increased risk for asthma. Number 4, exposure to smoke. Prolonged exposure to first-hand or second-hand smoke can seriously damage the lungs in 2 major ways. First, tobacco smoke harms the microscopic hairs known as cilia that line the airways. Second, smoking tobacco damages the air sacs in the lungs, making it more difficult to take in oxygen and get rid of carbon dioxide. Plus, beyond the increased risk of asthma, COPD, secondary pulmonary hypertension, and lung cancer, smoking can also lead to chronic cough or smoker's cough and make prolonged physical activity more difficult. Number 5, asthma. Asthma is a chronic condition involving inflammation of the lungs. About 20 million Americans live with asthma, which can lead to shortness of breath and wheezing. Like COPD, asthma is commonly treated with a combination of measures, including steroid medications to reduce inflammation and lifestyle changes to avoid triggers. Number 6, COPD. COPD is an umbrella term describing several severe lung diseases, including chronic bronchitis and emphysema. While these conditions may affect the lungs differently, they all result in respiratory issues stemming from lung damage. Despite the variety of conditions that can influence short and long-term respiratory issues, there are several lifestyle habits that can help reduce your risk of complications and improve both heart and lung health, like quitting smoking, exercising, managing your pre-existing conditions, and avoiding lung irritants.
One way that occupational therapists can assist their clients is by performing a home visit to suggest ways that someone could make small changes within their home to help prevent falls. A home is a personal space, and an OT is looking to help someone continue living in the home they've always loved in the safest way possible. Here are some ways to modify a home to prevent falls. In various rooms of the house, there may be clutter on the floor. Things like shoes, dog toys, and remote controls can become tripping hazards. An OT can suggest keeping the shoes in a closet, putting dog toys in a basket, and keeping the remote control on a coffee table. Adequate lighting is also important to have in the home. When it's dark, it's important to have enough light to see. Having light bulbs with different levels of brightness and several lamps can help clients keep their home bright to see and move around safely. If a client's vision deteriorates, he or she can also consider painting the walls and doors a brighter color. This will provide contrast in their apartment and help them better distinguish their furniture and the floor to avoid falling. A narrow hallway may be difficult to walk through because of furniture. With little room to walk, clients may be more likely to trip on the furniture and fall. The OT could suggest moving the furniture to a more open space in the apartment. Around the house, it is important to check for loose rugs or rugs that stick up. These can be a tripping hazard for clients, especially on smooth floors like tile or hardwood. An OT can suggest either removing the rug or taping it down to avoid slipping or tripping on it. It is also important to consider placement of commonly used items on higher shelves in the kitchen. Clients may use a stepping stool multiple times a day to get these items. An OT can suggest that the client put more commonly used kitchen supplies on the bottom shelf and less used items on the top shelf so that they have to use their stepping stool less often. A handheld reacher can also be used to pick up items on high shelves. Sometimes an OT might find electric wires running in the middle of the floor. This is a major tripping hazard for the client. You can suggest having the cords placed against the wall and using electrical tape to keep them down. In the bathroom, there can be some slipping hazards related to the bathtub and water. Adhesive strips can be put on the bottom of the tub to prevent slipping in the shower. Grab bars can be installed for clients to use when getting in and out of the tub. And a bath mat can be placed in front of the tub to prevent a client from slipping on the wet floor when getting out. These are just a few common strategies you can use to prevent falls in the home. But remember, it's the choice of the client, and if they are hesitant to make the changes that you suggest, then you need to collaborate with the client to find other ways that work for them to keep them safe and at home.
Welcome to this fall prevention and home modification video. We will take you through this house and identify fall risks and talk about how we can modify this home to reduce the risk for falls. Let's first look at this entrance. Can you identify any fall risks? The step leading into this entrance is uneven, and there's a hole in the step right here. To decrease the risk for fall, it would be advisable to build a new level stair, and possibly add handrails for more support. Now let's move on to the mudroom. Notice how the mudroom is full of furniture and other clutter, obstructing the path into the house. To prevent falls, have someone help you move furniture and other items to make for a clear, unobstructed path into the house. Now let's move inside. Can you see any fall risks here? Notice the shoes cluttering the floor and the throw rug in the entranceway. Make sure to clear the floor of shoes, magazines, clothing, or other clutter. If you would like to keep throw rugs throughout your home, it is recommended to use double-sided tape or non-slip backing so the rugs won't slip. Now let's move to the kitchen. Are your shelves too high? Consider moving frequently used items to a lower shelf. Never use a chair or unsteady piece of furniture to reach high cupboards. If you must use something to reach high shelves, use a sturdy step stool with a bar to hold onto, like this one. Do you notice anything wrong with this stairwell? Notice the books right here. Never leave anything on the stairwell. This is a tripping hazard. You will also notice carpets on each stair, and there is a missing one right here. Make sure to regularly check your carpets for tears or loosening. Replace any carpets that are damaged. From this different angle, you can see the stairs have a light switch on both the top and the bottom. It is important that you have both switches so your lights can easily be turned on and off in the stairwell. The stairwell also has a handrail. Make sure that it is secure and not wobbly. For extra support, add a handrail on both sides. For additional lighting, add a night light. Can you spot anything wrong here in the bathroom? Notice there are more throw rugs, and this one here is curled up, making for a big fall risk. Remove throw rugs or make sure they fit properly and are secure to the floor with non-slip backing or tape. If you have trouble getting off the toilet, it is important that you do not use the sink as a support. It is recommended to install grab bars for the best support. Now let's look at the tub. Notice the non-slip rubber mat in the tub. It is important that you have this to prevent falls. If you need additional support, add grab bars or a shower chair or tub bench, like these ones. Do you notice anything in this bedroom? Always be careful of cords and move them out of the way so you are not apt to trip on them. There is also another throw rug. Remember to always secure them so you can't trip over them. Make sure to have a light switch or lamp within reaching distance of your bed. And lastly, always look out for these little guys under your feet. Thank you for watching our video. I hope you found it informative and learned new ways to modify your home to prevent falls.
Ten warning signs that your heart's not working properly. According to the Centers for Disease Control and Prevention, about 610,000 people die from heart disease each year in the U.S. alone. There are tons of factors that can cause a person to develop heart problems, but most of them come down to poor lifestyle choices. The good news is that your body gives you signs and warnings early on so that you can catch an illness in its early stages or even prevent it altogether. So here are 10 of the most common red flags that indicate bad heart health. If you notice any of them, consult your doctor immediately. 10. Pain that spreads to the arm. If their heart isn't working properly, a lot of men feel pain in their left arm, while women experience the same pain in either or both arms. Some women also report experiencing unusual pain in the elbow right before having a heart attack. This happens because the pain from your heart travels to your spinal cord where tons of your body's nerves are connected, so your brain gets confused and thinks that your arm is physically hurting when it's really not. 9. A cough that won't quit. A persistent cough can be a symptom of all kinds of health issues, and cardiovascular disease is one of them. For instance, a chronic cough that produces a pinkish bloody liquid is very common in people with heart failure. Despite what it sounds like, heart failure doesn't mean that the heart completely stops beating. It just means that a person's heart isn't pumping blood as well as it should be. As a result, the body doesn't get enough oxygen since it's carried to all the tissues by the blood. However, chronic cough can be a subsymptom of a much more serious symptom called dyspnea, or sudden loss of breath. This may also indicate serious heart disease. 8. Swollen legs, ankles, and feet. When your heart isn't pumping enough blood through the body, fluid from your blood vessels leaks into surrounding tissues. Your lower extremities are the most affected simply due to gravity. This condition is called peripheral edema, and many people who suffer from it don't, in fact, have heart problems. Such swelling may appear due to liver malfunction, hypertension, pregnancy, injury, altitude sickness, or even when you sit without moving for a long period of time. But still, it's quite common among people with heart disease, so you should pay close attention to it. 7. Nausea and loss of appetite. A lot of heart disease patients show a lack of appetite, nausea, or both, even if they've just had a couple bites of food. The reason for that is built-up fluid around the liver and intestines that interferes with proper digestion. These symptoms are usually accompanied by abdominal pain, upset stomach, or feeling bloated. In fact, abdominal cramps that come and go in short spurts are extremely common right before a heart attack. So if you're experiencing several of these symptoms at once, you should see your doctor immediately. 6. Extreme levels of anxiety. Several studies by the American Heart Association have shown that people who suffer from extreme anxiety from a very early age or most of their life are more prone to developing coronary heart disease. Anxiety can be caused by either a really stressful lifestyle or different problems like reoccurring panic attack and strong phobias. Some of the effects anxiety has on your heart include tachycardia or abnormally rapid heart rate, increased blood pressure, which over time can lead to coronary heart disease, and decreased chance of surviving a heart attack. 5. Lightheadedness or fainting. Feeling lightheaded and experiencing temporary loss of consciousness, also known in the scientific community as syncope, is super common among heart patients. Like we mentioned earlier, when the heart isn't pumping enough blood to all the organs and tissues, they don't get the sufficient amount of oxygen they need. Well, the brain is affected by this oxygen depletion too. And if blood flow is being blocked by a clogged artery or the narrowing of a valve, it can result in an extremely threatening and potentially fatal condition called cardiac syncope. Those who are at a higher risk of dying from cardiac syncope include people age 60 and older. Those with a known heart condition, men more so than women, and people who often faint during exertion or while laying on their back. If you ever feel shortness of breath and pass out easily, call a doctor immediately and have your heart checked. 4. Your skin becomes paler or takes on a bluish tint. Being naturally pale doesn't necessarily mean you have a heart condition, but sudden paleness can be a result of reduced blood flow due to a heart that's not pumping blood as effectively as it should be. Shock, which can be caused by any condition that prevents the blood in your body from circulating properly, is the main reason why people who are suffering from a heart attack or heart failure turn pale all of a sudden. This shock-induced paleness can appear all over the body or on a certain body part like a limb. If you notice that you've gone pale recently, don't panic. Check whether you're suffering from shock or if it's from some other issue like decreased number of red blood cells, a condition called anemia. 3. Skin rashes or unusual spots. 2 separate studies, one published in the Journal of Allergy and Clinical Immunology, and the other conducted by the American College of Cardiology, showed that eczema and shingles are high risk factors for developing heart disease. People with eczema were found to have a 48% chance of suffering from high blood pressure and a 29% possibility of having high cholesterol. They also found that those with shingles were 59% more likely to have a heart attack than people who don't have this condition. 2. Chronic or sudden fatigue. Fatigue can be one of the main symptoms indicating an impending heart attack. Women are more likely to experience heart-related fatigue than men, with 70% of female heart attack patients reporting that they'd felt extremely tired before their episode. Physical or mental activity isn't the reason for such exhaustion, and it increases by the end of the day if it's due to a failing heart. It's really hard for this symptom to go unnoticed. Sometimes it's exhausting just to perform even the simplest task, like making the bed or taking a shower. 1. Increased perspiration. Excessive sweating can also be an early warning sign of an upcoming heart attack. It might occur at any time of day or night. Again, this symptom is seen in women more often than in men. The scary part is that it's all too often confused with hot flashes or night sweats, both of which are typical in menopausal women. People experience flu-like symptoms, have clammy skin, and sweat regardless of the air temperature or physical exertion. Sweating seems to be more excessive at night, and you often see damp bed sheets by morning. The areas that sweat the most are the palms, feet, top of the head, and chest. Remember that prevention is better than cure. You can do your heart good by maintaining a healthy lifestyle in which exercise plays a major role. Avoid fried or processed food, and staying as far away as possible from smoking and excessive alcohol consumption. It's also worth mentioning that the symptoms we've discussed today don't necessarily appear in every heart disease patient, but they are some of the most common warning signs of this affliction. So stay alert and take care of yourself. Do you know any other symptoms that are a red flag for approaching heart disease? Let us know in the comments below. And remember to hit the like button and subscribe to our channel. This way you'll stay with us on the bright side of life.
There really are 4 things every American should do. 1 is not smoke. 1 is get their body mass index down to around 25. Now, it doesn't have to be 25, it could be 27, 27 and a half. If you don't know what body mass index is, go on Google and search it and it'll give you a formula. Put in your height and weight and it'll tell you what it is. 1 is eating at least 5 fruits and vegetables a day, and that is really important. And then last is trying to exercise at least 150 minutes a week. And that's vigorous exercise, walking fast, something like that. If you can do those 4 things, it's been shown to lower your risk of dying, having a heart attack, having a stroke by 40% in just 4 years. Now you may say that's not much, but let's compare that to something else. Let's compare that to stents. Stents don't lower your chance of that at all, those things at all in a stable, chronically stable patient. Bypass, it's about half that good, even if you have a lot of narrowing of your arteries. What about the drugs we take, Lipitor, Zocor? That's maybe a third or a quarter as good. So these lifestyle things are incredibly important, and only 3% of Americans do these 4 things. And that's the sad part, because these are not things that are toxic. These are not things that are going to hurt your liver, not things that are going to cost you a lot of money. In fact, they'll probably save you money. Yeah, it's a couple of groups. 1 is the family history. I think we're all paying more attention now to family history. And the people knew that their father had a heart attack at age 48, and they're now 46, and they're starting to get concerned about it. It is people that have had problems, and we're seeing early and earlier patients present with heart attacks and strokes. We've got a patient on the hospital service now that's age 21. That's too young. And they're starting to say, gee, it may not have been in their family, but it may have been a coworker or somebody like that, and says, gosh, you know, if Fred or Mary had this thing, am I at risk? And they're coming in for that. And the third group is people we're seeing that have known disease, that are doing everything they can in terms of getting bypassed, getting medicines, but they're still having trouble. And they're coming in saying, what else do I need to do? And it's kind of funny because now we're kind of going back to what's the basics and say, what are the basic things you need to do? Exercise, eat right. All the things your mother told you that we never really had quantified. And some of these studies really are just in the last year and a half that have shown us how effective. In fact, this one study of the 4 things was a 16,000 patient study. They brought 16,000 patients in and said, do these 4 things: eat right, don't smoke, exercise, and lose weight. And that just came out in the last year and a half. Because when I was an interventionalist, patients would come in with an acute heart attack. They'd be in asystole, their heart wouldn't beat. They had a total occlusion of their front left artery, and their mortality could be as high as 25-30%. But with intervention, a stent, a balloon, you could have a 92% chance of treating them, getting out of the hospital 4 or 5 days later, walking out vertically. Success. So that was a pretty good success rate. Very satisfying. Prevention's a little different. People come in, they're not eating right, they're not exercising, they're stressed, they're not taking care of themselves. The national average to get someone to change is about 2%. So we have a 98% failure rate. And there really is not much research in that area other than giving statins and some of those drugs. So we're trying to do research that says, what are the things we really need to do to help you by getting back to the basics? Because we're finding, especially this ARC study has shown us, it is so important just to get back to the basics and take care of yourself. We're investigating a couple things. One is these agents that lower your cholesterol, like stanols and sterols, combined with fish oil, which we know can lower your chance of sudden cardiac death. Fish oil is the only food ever endorsed by the American Heart Association. It's the only pill I take every day, because about 1,000 milligrams of DHA and EPA, the 2 active ingredients that's on the side of the bottle in fish oil, will lower your chance of dying suddenly, significantly. And it's a pretty low risk thing. We're studying that. We're studying what types of things lead patients to change their behavior. We all tell patients things, and that's educating them, but we're not changing their behavior, which is a whole different kettle of fish. And that takes a lot of research to look into that. We're looking into your own body's stem cell response. We know that people that have a heart attack and start exercising after a heart attack have more stem cells, the cells that are the progenitors that can go to your heart and help grow new muscle. That the ones that are active and do exercise after heart attacks have a lot more of those cells than ones that aren't. So again, it's looking into the things you can do as a patient to really help yourself the most.
Proper glove removal. Follow these steps to prevent the spread of pathogens. Pinch the first glove at the wrist and pull down, touching only the outside of the glove. Ball up the removed glove in the palm of your gloved hand. Slide an ungloved finger inside the other glove, touching only the inside with your ungloved finger. Peel the second glove off inside out, trapping it in your palm. Discard the balled up gloves in the proper receptacle. Clean your hands with soap and water or alcohol-based cleaner.
OSHA Blood-Borne Pathogen Training. This course addresses the Occupational Exposure to Blood-Borne Pathogens Standard. OSHA's Blood-Borne Pathogens is a federal OSHA standard that prescribes safeguards to protect workers against the health hazards from exposure to blood and other potentially infectious materials, and to reduce their risk from this exposure. Table of Contents. Lesson 1. Introduction to Blood-Borne Pathogens. Get ready. You are now ready to start the course. Press Lesson 1. Introduction to Blood-Borne Pathogens. Lesson Outline. Introduction to Blood-Borne Pathogens. What is a blood-borne pathogen? Blood-borne pathogens are microorganisms such as viruses or bacteria that are present in human blood and that can cause disease in humans. These pathogens include, but are not limited to, hepatitis B, HBV, hepatitis C, HCV, human immunodeficiency virus, HIV, malaria, brucellosis, syphilis, West Nile virus. Other potentially infectious materials. In addition to human blood, blood-borne pathogens can also be found in other potentially infectious materials, including the following body fluids, especially because of their potential to be contaminated with blood. Blood products, such as plasma or serum, saliva in dental procedures, semen, vaginal secretions, skin tissue and/or cell cultures, any other bodily fluid that is visibly contaminated with blood. The following body fluids are not expected to be infectious sources of blood-borne pathogens unless they are visibly contaminated with blood: vomit, tears, sweat, urine, feces, sputum, nasal secretions. Note: since you may not always be able to tell whether a bodily fluid has been mixed with blood, it is best to treat all bodily fluids as potentially dangerous. Transmission of blood-borne pathogens. Blood-borne pathogens can be transmitted when infectious blood or other potentially infectious material is introduced into the bloodstream of a person. Transmission of blood-borne pathogens in the workplace can occur through infected blood or other potentially infectious materials being introduced through non-intact skin, acne, scratches, cuts, bites, blisters, or wounds. Contact with mucous membranes found in the eye, nose, or mouth, contaminated sharps or needle injuries. The need for a safety standard. OSHA estimates that 8 million workers in the healthcare industry and related occupations are at risk of occupational exposure to blood-borne pathogens, including, but not limited to, HIV, the virus that causes AIDS, hepatitis B, and hepatitis C. According to the Centers for Disease Control, 100,000 Americans have died from AIDS, and over 1 million Americans are infected with HIV. About 65 cases of HIV infection due to occupational exposure occur each year. About 8,700 healthcare workers are infected with hepatitis B each year. About 200 healthcare workers die from hepatitis B each year. 1 milliliter of blood can contain over 100 million infectious doses of hepatitis B virus. 60 to 70% of the individuals infected with hepatitis C virus show no discernible symptoms. According to the Centers for Disease Control and Prevention, hepatitis C virus infection is the most common chronic bloodborne infection in the U.S. The OSHA Bloodborne Pathogen Standard. OSHA published the Occupational Exposure to Bloodborne Pathogens Standard on December 6, 1991. The purpose of this standard is to protect workers by limiting occupational exposure to blood and other potentially infectious materials. In 2000, the Needle Stick Safety and Prevention Act, Public Law 106-430, mandated that OSHA clarify and revise the bloodborne pathogens standard to address the implementation of safer needle devices. OSHA published the revised standard in the Federal Register in January 2001. The revised standard became effective in April 2001. The Bloodborne Pathogen Standard is located in Title 29 of the Code of Federal Regulations, 29 CFR 1910.1030. Who is covered by the standard? All employees who could be reasonably anticipated to face contact with blood or other potentially infectious materials as the result of performing their assigned job duties are covered by the bloodborne pathogen standards. This list shows examples of some of the professions at risk of occupational exposure to bloodborne pathogens. Let's take a quiz to review what you've learned. End of demo. Thank you for going through the bloodborne pathogen training demo. If you would like more information, please contact us at telephone 512-402-5963 or email sales@bloodbornepathogentraining.com. Also, for more information, please be sure and visit our frequently asked questions page.
Airborne pathogens can be found in almost every environment, but there are measures you can take to reduce your risk. OSHA doesn't have specific requirements for airborne pathogens, but it does expect employers to protect employees from known hazards. There are 3 types of airborne pathogens: viral, bacterial, and fungal. When an infected person coughs or sneezes, tiny droplets of moisture containing the pathogens are released into the air. Depending on the environment, the droplets can remain airborne for several hours. These droplets may be inhaled or carried to mucous membranes by hands that have touched a contaminated surface. Luckily, exposure to airborne pathogens does not always result in infection. Tuberculosis, or TB, is one of the most serious airborne pathogens. It is a bacteria that usually affects the lungs, but may also attack the brain, spine, or kidneys. Many people with TB infection may not be sick because their bodies are effectively controlling the bacteria. Later, however, they may develop the disease and become contagious. Most cases of TB will develop within 1 to 2 years after exposure. Often there are no symptoms, but as the disease advances, symptoms can develop such as weight loss, fever, and night sweats. Weakness, chest pain, lung problems, and coughing up blood are also associated with TB. A tuberculin skin test called the MAN2 test can identify infection, but it cannot differentiate between infection and the disease. There are 2 blood tests that can identify infection as well. But a chest X-ray is necessary to confirm the infection has developed into disease. To prevent TB transmission, employers should develop a 3-tiered plan containing administrative, environmental, and respiratory protection controls to lower risks for employees. The course workbook includes specific information about these controls.
If you have been exposed, report it to your employer. You also have the right to be informed if you've been unknowingly exposed, and you have the right to be tested. Your employer must make arrangements for you to receive appropriate treatment and maintain records of employee exposure. All active TB disease must be reported to public health officials.
Treatment for TB depends on several factors, which include length of exposure, your age, overall health, lifestyle, and your occupation. TB is generally curable with a combination of antibiotics taken for 6 to 12 months. But bacteria can become resistant to the drugs if they are not taken correctly and fully. Influenza is caused by a virus that infects the respiratory tract. Unlike the common cold, the flu can cause life-threatening complications. Many of the precautions taken for TB will also lower the risk of flu infection. Influenza virus is primarily spread through the air, but it can also be contracted when handling contaminated objects, such as keyboards, phones, doorknobs, steering wheels, and money. Symptoms to watch for are cough, runny or stuffy nose, thick mucus, muscle pain, stiffness, fatigue, headache, sore throat, shaking, chills, fever, dehydration, and difficulty breathing. Rarely does the flu cause vomiting. What is commonly called stomach flu is actually not related to influenza at all. Preventive measures are good hand washing and respiratory hygiene, social distancing, avoiding crowds, and staying away from sick people. 6 feet is a good measure, and staying at home if you or anyone in your household is sick.
By following these guidelines, exposure and infection by airborne pathogens can be greatly reduced. It's everyone's responsibility to contribute to a safe and healthy workplace.
The flu is one of the respiratory viruses that causes disease every year in the fall and winter and early spring months. Flu season or respiratory virus season usually starts sometime in October or November, and it can stretch anytime through the early spring months and sometimes even as late as April and May. The flu virus is easily transmitted person to person through coughing, sneezing, and unwashed hands. Particularly when people are indoors in close proximity to each other, flu and other respiratory viruses are easily transmitted quite quickly through populations. Some people think that all kinds of head colds are the flu, but the flu is actually a specific disease that is caused by a virus and causes symptoms of fever, headache, sore throat, body aches, and some gastrointestinal symptoms. It can be quite severe and even fatal at times.
We do have an antiviral medicine that we can use to treat influenza. It can be given, and it works best if you take it early in the course of your illness, so shortly after you develop the first symptoms of influenza. We especially consider it in people at high risk of complications like young children or elderly. What's most important when you get flu is that you rest, drink lots of fluids, and take medicines to help control your fever.
The influenza virus can infect anyone, but some of the most vulnerable populations are the very young, the very old, and people who have underlying health conditions.
So the most important protection against influenza is the influenza vaccine. In addition to that, though, people need to be very smart in the winter. We need to use good respiratory etiquette. So if you're sick, you need to cover your mouth, cough into your sleeve. You need to wash your hands really well. Recognize that people around you that have a fever or sneezing or coughing can be contagious and can get you sick. So try to avoid people that are sick. And if you are in their presence, make sure they're covering their mouth, using good respiratory etiquette, and that they're washing their hands a lot. The recommendation is that anyone over 6 months of age get the influenza vaccine every year. The vaccine works usually very well. There's some seasons where the vaccine has a mismatch, meaning what we put into the vaccine doesn't match that well against the strains of influenza that are in the community. It's a little hard to predict that before we get the vaccine. We usually learn more about that after we get the vaccine. But the vaccine is still the best method that we have to protect people against influenza. Usually any vaccine will give some protection. There are always going to be some people that get influenza despite getting the vaccine, but the vaccine does protect against severe influenza and death. So we strongly encourage all people to get the influenza vaccine every year.
Grandma asks the same questions 50 times a day. What time is it? And what are we doing? I get so frustrated because even after I answer the question, she'll ask the same thing again a minute later. It's driving me crazy.
What time is the party?
It's 6 o'clock.
What time is it?
Almost 5.
What time is the party?
Weren't you listening to me? I answered that 2 minutes ago. The party's at 6. Now stop bothering me. I need to finish wrapping her gift.
Repetitive questions are a common behavior in those with dementia. Many families find themselves at a loss for a solution and become frustrated with this behavior. Repetitive questions are often triggered by anxiety caused by memory loss. The best approach is to reduce these triggers and focus on alleviating anxiety and uncertainty. As the disease progresses, people with dementia lose the ability to remember what they have just said or done. Sometimes it is their inability to express a need or emotion.
What time is the party?
Let's find out together. So let's look at this afternoon's schedule. 4 o'clock was nap time. We already finished that. And 5 o'clock, which is now, we'll get dressed. And then 6 o'clock is Jane's birthday party. How about you help me sign her card? How does that sound?
Okay.
People with dementia are sometimes unable to verbally express their needs. It can be useful to look behind the questions to see whether the person needs some reassurance or attention. Here are some tips on how to modify repetitive questions and alleviate anxiety and frustration. Try using a tool like a dry erase board to help keep track of her daily schedule. Make sure to keep it in a place where she will see it often, such as the kitchen or living room. Use capital letters and neat writing so it's easy for her to read. It may take a while to get your loved one to check the board, but it can have a considerable effect on her level of anxiety. Avoid mentioning an upcoming event or appointment until it's time to get ready for it. Be patient. If she senses your annoyance, she might pick up on this emotion and become anxious or agitated. Be well prepared. If you need to be somewhere, get yourself ready ahead of time so that you may focus your attention on helping your loved one. Avoid visual cues that can trigger the questioning, like a birthday present or purses and keys by the door. Do not rush your loved one for appointments. Allow plenty of time for her to prepare for whatever activity is on the schedule.
My father used to be so active, and now he just sits in his chair for long periods of time, tapping his hands. It's so annoying. Dad, that tapping, it's irritating. Please stop. Dad, cut it out. Just watch TV quietly, please.
Repetitive behaviors occur in some people with dementia. They may do this because they are not able to remember recent events or actions. They might also fixate and repeat words or gestures to soothe themselves. A repetitive behavior could also be considered as an attempt to communicate an unmet need, anxiety, unspent energy, or physical discomfort. As with problematic behaviors, try to identify the underlying causes to effectively reduce and manage its occurrence.
Dad, you've been sitting here all day. Let's get you up and go grab a snack. Dad, come keep me company while I work. Have a seat. Here are your stacks of magazines for you to work on. And I will put on some music while we work.
Okay.
Once you've identified the underlying causes of a repetitive behavior, you can begin to manage its occurrence. Remember that not all repetitive behaviors are bad, especially if they're not a source of disruption or puts your loved one at risk. Here are some tips on how to manage repetitive behaviors. Search for what might be causing the behavior. Are his basic needs being met? Ensure that your loved one is not hungry, thirsty, in pain, or needs to use the restroom. The repetitive behavior may be an attempt to communicate his needs or feelings. Do not take aggressive steps to stop the behavior, especially if it's harmless. Do your best to ignore it, but be certain to only ignore the behavior, not your loved one. Place a gentle hand on your loved one's shoulder, arm, or hand to redirect his focus to you and away from the behavior. Provide reassurance and try to include your loved one more in your daily routine. He may simply want to feel engaged and included.
My father gets into everything at home. I feel like I have to watch everything he does or else he gets into trouble. I could really use some help. you doing? God, you should not be cooking. Look at the mess you've made.
I was hungry. I wanted a grilled cheese sandwich.
I am sick and tired of this. You're never to come in the kitchen again.
I'm sorry. I was hungry.
Dementia can affect judgment, behavior, physical ability, and a person's senses. All of these factors can contribute to safety issues. Home modifications are needed to keep the home safe. As dementia progresses, a person's ability and judgment diminish, making the home a potentially dangerous place. Here are some tips to help keep your loved one safe in the home. Use child safety locks to store away medications, chemicals, and sharp items such as razors and knives in a safe location. Lock away weapons or remove them. Throw away expired food and keep food that you do not want your loved one to access out of reach. Have the phone number to the poison control easily visible. Remove or cover knobs on stoves and ovens. Install a remote on-off switch or turn the gas off if necessary. Signs with step-by-step instructions can be used to remind your loved one of how to use small appliances. Unplug or remove small appliances from site if they're too dangerous to use. It takes effort and creative problem solving, but in the end, safety modifications can keep your loved one safe at home.
I hired a caregiver to stay with my mom while I'm at work. My mother becomes mean and aggressive towards the caregiver when she tries to get her ready in the morning. Like, mom yells at her to get out and may even try to slap her away. It is a daily struggle and the caregiver is ready to quit. I can't be with my mom every single minute and I don't know what to do.
Tina, it's time to wake up. Let's go to the bathroom to clean up. Let's get out of bed.
I don't want to get out of bed. I don't want to get ready.
Come on, not again. Please don't give me a hard time. Your bed is wet. You need to wash up. It's 9 a.m. It's time for your breakfast and medication.
I don't feel like it. I don't need your help.
Stop it and calm down.
Don't touch me. How dare you telling me what to do? I don't need your help!
I am just doing my job. Let's get ready for the day.
I don't need you. Get out of my house and leave me alone!
People can become aggressive for many reasons. It may be an expression of pain, fear, frustration, depression, or anger. People with dementia may not understand what you're asking them to do and become frustrated. They may genuinely not understand what they need to do something, like take a pill or bathe. Aggression usually isn't personal, although it certainly feels that way. Reacting to aggression with anger, shock, or yelling only escalates the situation. First, de-escalate the situation by behaving calmly. Identify yourself if you need to. It's possible that your loved one does not recognize you. Speak to the emotions that might underlie the aggression. It could be fear, pain, or frustration. Use distraction, encouragement, reassurance, and try to be flexible if someone is being uncooperative and angry.
Good morning, Tina. This is Jane, your caregiver. Your breakfast is ready. Would you like to eat downstairs?
I like my bed. I want to stay here. You can bring my breakfast here in bed.
I can do that. I see that your bed is wet, though. I would like to make your bed so you can rest comfortably. Meanwhile, would you like to eat at the dining table?
No. I want to have my food here in bed.
Okay. How about if you eat right over here, just while I make your bed?
Okay.
Okay.
Fine.
Here are a few tips on how to respond to aggressive language and behavior. Keep it simple, one instruction or question at a time. Don't escalate tensions by being bossy or yelling. Instead, use a calming tone of voice, but do not be condescending. Provide reassurance. Let your loved one know you're there for support. Keep your body language positive and use calming gestures and gentle touch. Give ample time. Redirect or give ample time and space for cooling off and reattempt later. Remain safe. Back away slowly if the behavior is threatening. Remove or lock away all weapons like guns and knives. Call 911 if physical aggression cannot be redirected and your loved one is a danger to themselves and/or others.
My mom's become resistant to my help, and she's now hard to handle. She hasn't been able to manage her basic day-to-day needs without my help, but she believes she doesn't have any problems and doesn't need help. She's easily agitated and gets upset when I try to get her dressed. I'm just frustrated, and I don't know what to do. Mom, where are you? Mom, we're gonna be late for your doctor's appointment. Are you seriously planning on wearing that? It's 80 degrees outside, Mom. Okay, look, let's wear this instead. We don't have time, okay? Let's hurry. Mom, oh, God, what is wrong with you?
Oh, leave me alone. I can do it.
No, Mom, let me, gosh.
Leave
let
me
help you.
alone.
I can help you, Mom.
I don't need your help.
God,
leave me alone. Get out.
Do this to me.
Agitation and anxiety can manifest as difficulty sitting still, pacing, fidgeting, acting irritable, afraid, nervous, worried, or just being resistive to help from others. The behaviors are often triggered by a feeling of loss of control, misperceiving situations or actions as threats, unmet needs, inability to communicate clearly, and frustration with tasks or interactions with family and caregivers. Changes in a usual routine can also cause agitation and anxiety. People with dementia, for example, may have impaired insight towards their own cognition and ability level due to their disease. For this reason, they have a hard time understanding their limitations about what they can and cannot do. They may not realize that they need help, as they do not see themselves as having problems. This can lead to agitation when someone tries to help them. How one approaches a person with dementia makes a difference. If you feel angry, impatient, or frustrated, or if you rush someone or seem irritable, they can sense your mood and react with apprehension, resistance, anxiety, and agitation. Agitation can then escalate to inappropriate behaviors, such as hitting or biting. It is very important to remember that persons with dementia react and respond to how a caregiver approaches them. How you speak to them is key.
Good morning, Mom. How you feeling?
I'm all right.
Okay, what would you like to wear today? You look good in the green or the blue? Which color do you want to try
I
today?
don't need your help. I can do it myself.
Okay. I'm sorry that I made you feel that way, okay? You're doing very, very well, and I'm just here to help in case you need me. I know you can do it yourself very well. I love you so much, and I just want to be here when you need me. Can I stay with you? We can do this together? Okay, good. So we are going to go to the doctor's, and then we can go get some ice cream. How does that sound?
Oh, that sounds good.
Okay, let's get you dressed, Mom. Let's lose this. We want you to be comfortable after all. Let's see. Yeah, I think this is going to look good. Perfect.
Here are a few tips on how to respond to agitation and anxiety. Allow ample time to complete tasks and don't rush your loved one. Use a gentle tone of voice, but do not be condescending. Try to keep your body language positive and use calming gestures and a gentle touch. Don't be demanding or bark orders at your loved one. Instead, provide reassurance. Speak in calming tones and phrases. Let the individual know you're there for support. Try to schedule activities around your loved one's natural routines. For instance, if your loved one is a late riser, plan doctor's appointments for the afternoon. Simplify the environment to reduce frustration or confusion. For example, thin out the closet so that it is easier for your loved one to see inside. Have fewer clothing options to choose from, and clothes that are easy to put on.
My father's been living with me for 2 years. He started wandering in the house, trying to go out the front door, saying he wants to go home. Oh, why is that happening? And I don't know what to do to stop it. You can't go out.
I'm gonna go home.
This is your home.
No, I'm going to my house.
This is your home. Stop.
Wandering can occur as dementia progresses. It can be triggered by someone reliving an old memory, not recognizing where they are, or by a feeling of distress. People with dementia have less ability to communicate or explain where they're going or why they want to go somewhere. Wandering can be triggered by seeing things that signal leaving, such as the front door, purses, keys, or coats. If someone is wandering, approach them in a calm and reassuring manner. Ask them where they're going or what they need, and then distract them with a new activity.
Dad, where are you going?
I want to go home.
You are home.
No, I want to go home. The kids need me.
This is your home. See? Here's a family picture. There's me and there's Tom.
But where are the kids?
I'm right here, Dad. I'm your daughter, Jane. And Tom, your son, he just lives 5 minutes away. Let's all give him a call on the phone and say hello.
That sounds nice, honey.
Okay, come on.
Wandering can still happen, even if you're the most diligent of caregivers. Use the following tips to help lower the chances of wandering. Use a calm tone of voice and ask your loved one where he's going or who he's looking for. Reassure him that he's home, point out familiar things around him, and then immediately distract him with a pleasant activity to allow him to forget his urge to wander. Disguise the door by painting it the same color as the wall or covering it with a large poster or picture. Murals for doors can be purchased on the internet. Cover the doorknob with a drape. Try placing a black doormat in front of the door. Some patients will avoid crossing the mat. Put signs on doors to discourage leaving, such as stop signs, do not enter, or keep out. Make sure your loved one is getting enough exercise. The urge to wander could be a result of unspent energy. Ask if he has any needs. He might be wandering because he feels physical discomfort or stress. Be specific. Ask if he would like a sandwich or some coffee, or if he needs to use the bathroom. Do not leave coats, hats, or keys in plain sight or by the front door, as they can trigger the urge to leave.
My mother used to shower every day. Now, if I don't remind her, she refuses to bathe at all. If I try to help her, encourage her to take a bath, she argues with me and gets upset, says she's afraid of the water. What can I do? Mom, it's 8 a.m. Time for your shower.
Oh, I don't need it. I don't want one.
Mom, come on, please. We've gone over this over and over.
No, leave me alone. Don't touch me.
Come on. It's been a week since your last one. You need one. Please, get undressed.
A person with dementia will often refuse, withdraw, or fight during a bath or shower. When you're helping someone to bathe, it's important to be sensitive and tactful and to respect their dignity. Remember, washing is a personal and private activity. Bathing can be scary for patients as dementia progresses.
Okay, Mom, it's noon. It's time for your spa treatment.
Oh, I don't really want to go.
But you love the spa. Makes you feel like a queen. Yeah, and after that, we'll go to your favorite restaurant for lunch.
Well, okay, I guess.
All right, good. Let's go. So first, let's start by unbuttoning your shirt. I'm going to do the top button, and then can you help?
Okay.
Okay. Good job, Mom. Okay, Mom, I'm going to put a little water on your toes. No, test it. See if it's okay. How's that feel?
It's warm.
Good. Now let's wash down there. Can you do that by yourself?
Yes.
Great. There you go. Okay, we're almost finished. I'm going to turn the water pressure on low and fill up this cup with some water. I'm going to stand up. You just sit right here. Okay? Just lean your head back and pour a little bit of water on you. And we're going to gently massage your hair with your favorite gardenia scented shampoo. How does that feel?
Yeah.
Reassure your loved one that even though bathing is a very personal activity, you're happy to help. Ask how she feels and how she would prefer to do things. Here are some additional tips on how to help your loved one bathe. Be flexible on the time. If your loved one doesn't like to bathe in the morning, try a different time of day. If the word shower or bath causes anxiety, use a different term like spa or get clean. Make the bathroom inviting by using flameless candles, aromatherapy, or soothing music. It's important that your loved one feels safe. Install handrails and use a shower chair. Limit bathing to twice a week and give sponge baths in between. Let her know what you're about to do, one step at a time, and have her help as much as possible. Use a towel to drape over her to provide more privacy. If you don't have one available, consider installing a handheld shower head. Being able to aim the water can be helpful and less stressful.
My mother's been waking up in the middle of the night and seeing things in her room that aren't actually there. We're both exhausted during the day because we're not getting enough sleep at night. Good night, Mom.
Honey, help me.
What's wrong, Mom?
There's an evil man in the room.
Mom, please. There's nobody here. No one's here. Go back to bed. Come on. Look, there's nobody here. All right? Go back to bed. We've got a big day tomorrow. Come on. Good night, Mom.
A person with dementia may experience hallucinations when the disease affects the regions of the brain that are responsible for interpreting sights and sounds. Hallucinations commonly involve seeing or hearing things that aren't there. They can transform ordinary, everyday experiences into frightening episodes. A good approach to reducing hallucinations is to identify and eliminate the objects or things that trigger them.
Honey, help me.
What's wrong, Mom?
There's an evil man in the room.
Oh, really? Let me take care of it. It's okay. Oh, I see. Okay, come on. Come on, I'll take care of it. Now you stay out here. Now he's gone, okay? I'll sit with you until you go to sleep, okay?
Okay.
You know, Mom, I think we should keep your coat rack outside so you have a place to keep your jackets when you come in.
Oh, okay, dear.
Okay? Okay. Good night.
Remember, patients experiencing hallucinations are having a difficult time interpreting their surroundings. Remain calm, reassuring, and try to identify what may be triggering the hallucinations. If hallucinations persist after trying to eliminate them, be sure to discuss this with their doctor. Here are a few tips on how to reduce hallucinations. Look around and try to see things through her eyes. What might cause her to misinterpret what she sees? Identify potential triggers such as open curtains, shadows, mirrors, or televisions left on. In the bedroom, use a nightlight to create a more peaceful sleeping environment. Always remember to remain calm and reassuring. Do not yell or scold her. Help her back into bed and reassure her that she is safe.
Mr. Brown has moderate dementia and continues to live in his apartment. His only daughter lives nearby and works full-time. He's able to afford a private caregiver who stays with him when his daughter isn't able to help. He hasn't done well in adult day programs due to his sexually inappropriate behavior. I'm his fourth caregiver, as the others have quit when they can no longer manage his behavior. It's a real problem. All right, honey, it's time for bed. Let me help you up so we can get into your pajamas.
You want me to get undressed so we can get into bed together?
Don't be silly, sweetie. Let's just take your shirt off.
Why don't you take your shirt off?
Mr. Brown, I'm just trying to do my job.
You know you want to.
I'm going to call Susan.
Come on. Just put your hand here. Come on.
I can't handle this. I quit.
What do you do if the person you're caring for is sexually inappropriate? Sexual desire does not go away because someone has dementia. In fact, it could become more prevalent in someone who is lonely or bored. People with dementia often become disinhibited and lose sight of what is proper or improper. They sometimes say or do things that they normally would not say or do when they were well. So if someone is feeling sexually aroused, they may act on it and not be able to censor their behaviors. Sexual desire may arise on its own or be triggered by just being physically close to someone, providing help with personal hygiene, those kinds of activities, or by what someone inadvertently says. Situations like bathing, changing diapers, dressing, or bending over someone could trigger sexually inappropriate behaviors. If a patient acts inappropriately towards you, use distraction to change the subject. If that doesn't work, let that person know in a calm but firm voice that you're feeling uncomfortable and that the behavior is inappropriate. Keep a boundary between you and the person through more formal dress, watching how you speak to the person, and by being aware of your body positioning.
Mr. Brown, it's time for bed. I need you to put on your pajamas.
You want me to get undressed so we can get into bed together?
Mr. Brown, let's just get you changed.
Why don't you take off your shirt?
Mr. Brown, did you have a nice visit with your family earlier? I see they brought some new pictures of your grandkids.
You know you want to. Come on.
It's a little chilly tonight. I brought your warm pajamas. Let's get them on you so you don't catch a cold.
Come on, just put your hand over here.
Let go of my hand, sir.
Come on.
Let go. Thank you. Let's go brush your teeth and then we'll come back and get you dressed for bed.
Okay.
What do you do if the person you're caring for is sexually inappropriate? Without becoming upset, try redirecting the behavior by changing the subject or through distraction. Address someone by their name, either their first name or Mr. or Miss, but avoid more intimate names like honey or sweetie. If the sexually inappropriate behavior continues, firmly tell the person to stop what they are doing and that it is upsetting to you. If the inappropriate behavior includes masturbating, redirect them to their room to have some private time. Don't shame the person. Remain at a safe distance if you feel unsafe. If the behavior is directed towards a female caregiver, it may be necessary to hire a male caregiver instead, and vice versa. Preventative steps include wearing less revealing or tight clothes. Instead, wear something formal, like scrubs, to signal you're a professional. Be aware that just being physically close can trigger those behaviors, and adjust your body position as needed.